Hi everybody, I'm back to talk to you about cystitis or a urine infection and also interstitial cystitis, which I'm going to go on to, which is much more debilitating in the long term. So, what is cystitis? Essentially it's inflammation of the bladder, and more often than not it's caused by a bacterial infection, usually E. coli, which comes from our own bowels, purely because we're really badly designed with our place where the poo comes out too close to the place where our pee comes out. Symptoms can be present without an infection, and I'm going to talk about that. It's more common in women, and 75% of women will suffer from a UTI at least once in their lifetime, and obviously some people get it more often than others. You can, however, get it in children and men, particularly prominent in children when you're potty training them or they're learning to toilet on their own, because it's about wiping, and we'll talk about that. It is the most common hospital-acquired infection, so that's quite interesting, and it's generally because more catheters are used in hospital than anywhere else. So what are the symptoms of cystitis? Well, essentially it's pain when you're passing urine, so a terrible burning, a frequency, so you're going to the toilet more often, and when you go you pass smaller volumes and you still have that burning feeling that makes you feel like you need to go even though you can't, which is horrible. You can get pain in your abdomen, just above your pubic bone. You can get fever, you can get back pain, you can get blood in your urine, and you can get really smelly urine. And you can get some of those symptoms, all of them, or just one or two. It varies person to person and each time you get an infection. So why do we get urine infections? What are the risks? Well, being a sexually active woman is a risk because in sex you can spread around those bacteria more easily. It also can cause some trauma, and that allows bacteria to cling more easily to the lining of the tubes from the bladder and up to the kidneys. Pregnancy makes you more susceptible, as does diabetes, because bacteria love blood that has more sugar in it. Using a diaphragm for contraception with a spermicide puts you at more risk. Not many people use that form of contraception anymore, but it is a risk. Having a catheter put in, obviously, hence the hospital-acquired infections. After menopause, women become more susceptible to UTIs because you get some vaginal atrophy and the lining is much drier than it would normally be, so you get some chafing. Having an abnormality that some people are born with in their kidneys, or the tubes that run from the kidneys to the bladder and from the bladder to the outside, puts you more at risk. Using tampons, having radiotherapy, or if you're immunosuppressed, so if you have cancer or a disease that means that you're having your immune system suppressed so it can't fight bacteria quite so well. Having kidney stones, or even an enlarged prostate gland in men, make you more susceptible. Using vaginal douches, even if they say on the packet that they're really kind and they're pH balanced, they're a big no-no. You shouldn't use them, you don't need them. The vagina is really good at keeping itself clean. And women that have had genital mutilation can be at much higher risk of having urine infections because the urine can't escape so easily. So there are lots and lots of risks, essentially. So how is a urine infection diagnosed? Most urine infections will get better on their own, so you just need to keep really well hydrated. Some people swear by the over-the-counter remedies like cranberry juice, cranberry tablets, citrus drinks. I have to say there's little evidence for it, but I have lots of women, including me from time to time, who have used them and say they work really well. So in those cases, there's no other intervention needed, it just gets better, your body sorts it out. But you should see your GP if you're not sure if it's a urine infection, if you're pregnant, because it makes the uterus irritable and you don't want that when you're pregnant. If you're a man or a child, or if you're getting fevers and things aren't improving and you're generally feeling pretty unwell and it's getting worse, see your GP. The GP will use a dipstick in your urine, so another good tip is when you get there, ask reception for a urine bottle and do a wee before you go in to see your GP, because it just speeds things up and makes it easier. And if you've got symptoms, the diagnosis can be made there and then, or if needed, they can send the lab your urine and the lab can see if there's any bacteria that will grow in it. Excuse me. There aren't many complications of urine infections, but there are a couple of important ones that you need to know about. you can actually get a kidney infection, so it's called pyelonephritis, when the bacteria travel up towards the kidneys, and that's quite serious and you might need to be in hospital for that, for IV antibiotics. And if it gets that serious, you're at risk of sepsis. So those are the two major complications, but they don't happen very often. And usually UTIs are treated in GP quite easily, and then you get back to normal. So how do we treat them? So antibiotics are the mainstay of treatment, and we can do this in several ways. So if you've got a one-off urine infection, or you get one from time to time, you have a course of either 3 to 7 days, and that usually sorts it out. If, however, you've got a trigger, so for example, you're getting a urine infection every time you have sex, we can give you an antibiotic to take after you have sex immediately. Or if you haven't got a trigger like that, but you're getting urine infections all of the time and they are growing bacteria, we can give you an antibiotic to take every day at a low dose, and this is called prophylactic. And that can work well as well. You can do that for about 6 months until, hopefully, the infections stop. Struggling with my cough today. So what can you do to stop yourself getting urine infections? Well, as I said, don't use vaginal douches or washes. They really can upset the balance and spread bacteria around. Don't put any scented or fragrance bath oils or bubble bath in your bath, and if possible, shower rather than bath. Keep yourself well hydrated. Use a lubricant when you have sex to minimise trauma. Don't use a spermicide with a diaphragm for your contraception. When you've had sex, get up straight away and have a pee, that's really important. And when you go to the loo, always making sure that you wipe from front to back, which is really tricky, which is why it's hard for kids to learn it and why kids get urine infections. But it's important to not bring forward the bacteria from your bottom area to the front. So the other thing that you could do, which is a tip of mine that I give to all patients who have UTIs, is D-Mannose. Now, D-Mannose is a natural remedy that you can find in plenty of health food shops and online. It comes as a powder or capsules, and you can either take a low dose every single day, and it lines the bladder and the tubes that go from the kidneys to the bladder and the bladder outside, so that the bacteria can't cling on and cause an infection. And when you get an infection, you can up the dose. And it does work really well. I know because I've done it. I went through a period many years ago when I had a new partner and I was getting repeated infections and I was feeling absolutely rubbish, taking antibiotics all the time, which I don't like to do because they have side effects. And I, as a last resort at the time, went for D-Mannose, and it worked. And I never took another antibiotic. So now D-Mannose would be my first resort rather than my last resort. So I'll put it in the notes afterwards so that you can look it up, but I certainly recommend it. And I haven't got evidence for it other than I know it worked for me and I know it works for other women too. So there's a trick. Now, when that doesn't work, when women can't find anything that works and they're getting repeated infections, but we can't grow anything, we can't find a bug in the wee to say, oh, it's definitely E. coli or one of the other common bacteria, but they're still getting night pain, pelvic pain, frequency, urgency, and all of the symptoms that make them feel like they have cystitis. Quite often what they've actually got is called interstitial cystitis. And I want to spend a bit of time on that because it really is debilitating for the women that have it. So it's poorly understood, but we think about 400,000 women in the UK suffer from it, and they really do suffer. It's also called painful bladder syndrome, and it generally affects women in their 30s and their 40s, and quite often after they've had a bacteria urine infection. It's debilitating, and I'll talk about that a bit later. And quite often these women feel that their medical professional, yes, me, their GP, doesn't take them seriously and doesn't appreciate how much this is affecting their life. So what causes interstitial cystitis? Well, it's all of the things that I listed before for cystitis, but more. So, for example, certain washing powders or chemicals in washing powders and softeners can be an irritant. Swimming pool water with chlorine and other chemicals in it can actually make things worse. Allergies. People who really notice changes in the weather. find that they get flares of interstitial cystitis, or IC as it's called, when the weather changes, and they can really map it like that way. Skipping meals, using certain toilet paper brands, believe it or not, certainly fragrance ones are a no-go. Standing for long periods, having a bumpy journey and going over bumps in the car can even be an irritant. Certain foods and drinks, and I'll go over those later because they seem to be really important. Periods, you can actually sometimes map flares of interstitial cystitis to your menstrual cycle. So as you can see, the list goes on, and there are other things too, even physical activity, for example. And we know that exercise is good for you, but if you can't do it because it's making your symptoms worse, it's just another problem. So I mentioned foods, and I'm going to go into those in a bit more detail because they seem to play quite a big role. So certainly caffeine is a problem, or seems to be a problem for lots of people, and coffee. Not just caffeine in coffee, but coffee itself. Fizzy drinks are often quite difficult to bear. Alcohol, smoking, chocolate, high acid foods, so anything with citrus or acid in it, citrus drinks, fruit, and anything in that arena. So you have to look very, very carefully at processed food if you're buying it to see whether or not they're using citric acid or high acids of another type. Monosodium glutamate can be a problem, so you have to avoid Chinese if that's the case, and again check all your processed foods because it can be used in those foods. And sweeteners seem to be a problem. And I think the interesting thing about that food list is it's quite similar to the foods that seem to be a problem in irritable bowel syndrome. And I'll come on to that later. But certainly food is something that you have to look at very carefully if you've got interstitial cystitis. So how do we make a diagnosis of interstitial cystitis? Well, it's quite often a clinical diagnosis. So if you're having repeated symptoms of urine infections, but we can't grow anything in the lab, so it's not a bacteria we're dealing with, we can actually make the diagnosis on that basis alone and try and help you and treat you. But if what we're doing and the treatments aren't working, we can refer you to a urogynecologist. So that's the gynecologist that specialises in the bladder and all of the tubes that lead to it and from it. They can do a cystoscopy, which is pop a camera inside and have a look at the bladder wall. And they quite often find redness or swelling. They can take a biopsy of the bladder wall to see what's going on and to make sure there are no ulcers or cancers or any other abnormalities which don't fit with the diagnosis of interstitial cystitis. They can look at the protein barrier that we all have inside our bladder, lining it, and sometimes in interstitial cystitis they can see that that barrier is breaking down in parts, and that's possibly why people get the pain, because urine is seeping through into areas where it shouldn't be and causing irritation. So what's the treatment? Are there treatments? Yes. So as with all of medicine, there isn't one treatment for one person. You have to do a trial and see what works for you and mix and match. And that can be really frustrating if you're really debilitated and things aren't working. But there are lots of things we can try. So first off, lifestyle obviously is really important. So looking at that food list, doing a food diary and a symptom diary and trying to work out what your triggers are. Making sure that you don't smoke, because that is an irritant. And reducing stress wherever you can, which I know is really easy to say. And exercise if you can, as long as it's not one of the things that's one of your triggers, obviously. Because we know that exercise all round helps with mood and general well-being. Physical therapy for the pelvic floor with a specialist physiotherapy can sometimes help with those urgency and frequency problems. And bladder training, where over a period of 3 months you teach your bladder to hold more and more urine and break down that frequency if you can, often works very well as well. There's medication and there are some procedures. So in terms of medication, starting as we always do at the very bottom, over-the-counter painkillers, and that can sometimes be enough. Over-the-counter antihistamines can often work quite well, and we're not sure why, but just calming down a histamine reaction in that area often helps. Then some prescription-only painkillers that work on the nerves in the area, so they're amitriptyline, gabapentin and pregabalin, and they can work for some people. bladder muscle relaxants like tolterodine, solifenacin and myobegron can work very well. So again, it's trial and error to see which ones work for you, and I guess it depends what your symptoms are and what's causing your issue. Cimetidine is another antihistamine that can work well on relaxing the bladder. And then there's another medication called Almiron, which is a pentosan polysulfate sodium medication, and that can repair the lining of the bladder that's causing the problems. So those are the medications. We can do things like bladder installations, where we pop a very fine tube called a catheter into the bladder and fill it with a particular medication to treat those abnormalities in the bladder wall. And those installations can contain lots of different things, from lignocaine for pain relief, to hyaluronic acid to rebuild areas, chondroitin, heparin, which is a blood thinner, and steroids to calm down the inflammation. And again, your doctor will try and find the one that works best for you, and it could be, again, trial and error. In terms of procedures, once we're inside the bladder, we can cauterize any areas that are bleeding. We can use Botox to relax the muscles which are overactive around the bladder, and that can work really well. Needs repeating every 6 months or so because the effect wears off, but it does work well. There are some side effects in terms of not being able to pee sometimes, and that's obviously a problem, but it does always wear off, and then the doctor next time could use a different dose or in a slightly different place. Neuromodulation, which is where the nerves to the area are stimulated in a different way to the way that your brain currently does it. That works for some people. And bladder stretching can give temporary relief for about 2 to 4 weeks. And that's where the bladder is filled with fluid and stretched beyond its normal capacity. And that seems to help with pain. And then surgery. So although it sounds drastic, we can reroute the urine in a slightly different way to normal, and that can help, especially if there's an obstruction or an abnormality along the way. You can actually remove the bladder totally. Now, obviously this is last resort, but some people do turn to it because they feel it works for them and they don't want the symptoms anymore, and they don't have them anymore after this surgery. And we reroute the urine to come out of the tummy wall into a bag. And then there's a procedure where you can actually make the bladder bigger so it's got more capacity. So hopefully you can see that there are lots of treatments, from nothing to exercise to lifestyle through to medications and surgery. And what if that isn't working? What if none of those things are working? I think from the very start, not just at the end when it isn't working, it's really important to consider, is there another disease process going on here? Is there chronic fatigue syndrome, irritable bowel syndrome? And as I said, some of those food lists are very similar to irritable bowel syndrome, fibromyalgia, or lupus even. And some of the symptoms are very similar. So always make sure that your doctor has checked for those things as well and is looking for another answer to the question. Because if something isn't working, you have to ask why. And this is really important. Quality of life for people with IC is shown to be lower than people who have end-stage renal failure and have dialysis. And believe me, that's a pretty bad place to be. So that just goes to demonstrate how debilitating it is. They have nocturia where they're getting up to pee every 20 minutes in the night. So they're not sleeping, they have insomnia. They're unable to work often, unable to form or keep relationships often, or their relationship breaks down. And all of this leads to depression and suicide. And obviously there's a massive cost to society as well, because these women are carers, workers, mothers, partners, and they have an important role to play in society. So this is why it's an important topic. So hopefully I've shown you today that cystitis is fairly straightforward usually, and the treatments, if needed, are there. Interstitial cystitis is a debilitating disease that really does affect women and needs to be worked through very carefully so that we find some solutions. And there are some solutions. So in the notes afterwards, I'm going to put some support groups, some charities, D-Mannose, so you know to go and look for that. And please ask me any questions. If I've missed something, got something wrong, which is of course possible, let me know and let's talk about it. and suggest topics for the future. And as always, thank you so much for watching. Bye bye.